Hello, everyone. I am Dr. Fong. I am the founder of Clean Body, and I'm an eczema specialist and a naturopathic doctor. And today we are talking about a really important topic if you have eczema, because steroids are the main treatment that we are being given. We are going to be talking about moving beyond steroids today. Now, if you follow me, you know that I talk a lot about how do we heal eczema from the inside out? So I'm talking a lot always about gut and liver and all of these root cause issues that are really, internal in our system. And these are definitely at the root of eczema. But today we're going to go a different route. We're going to talk about how do we deal with eczema topically while we are actually working on that underlying root cause that is always there. And that's what I'm always talking about. So, I know you guys know about those root cause issues. So today we're going to really delve into what topicals can you use and which ones are actually effective if you're not going to be using topical steroids or other types of conventional medications on the skin. Okay, so today's topic, I know everybody is really interested in this because people are always like, how do I get more immediate relief? And yes, there are natural topicals that we can use that can provide more immediate relief. And we're going to talk about those today. Now, what we're going to talk about first, though, is why do we need to look beyond steroids, beyond calcineurin inhibitors? Why do we need to do that? Well, because there's a really frustrating cycle that happens. We apply those steroids, those calcineurin inhibitors, the skin improves, and then we stop the treatment, the skin flares, and this just repeats and repeats and repeats. If this has happened to you, please type yes into the chat. This has probably happened to all of us. Anyone here who has dealt with eczema or psoriasis or any inflammatory condition, really, we're dealing with using these conventional medications and we just have to keep using them over and over again. And there really isn't a long-term solution here. So, what is the problem with steroids? Well, they provide short-term flare control. Yes, they give us that fast relief from the redness and itchiness, but do they treat the root cause of eczema? No, not even in the slightest. And then we have this cycle of we apply, improve, it stops, it flares. This repeats forever and ever. Then we do have some long-term side effects, including skin thinning. We have the risk of something called topical steroid withdrawal. When you stop those topical steroids, and all of a sudden you get this rebound effect where you have redness and burning, and this is all over the body sometimes, and it is very, very difficult to treat. And unfortunately, sometimes we aren't told the risks of topical steroid withdrawal before we actually start using topical steroids. And then we end up in this place, and we want to try to avoid that, okay? Now, what are the problems with calcineurin inhibitors? These are not steroids, and so they don't have the problem of skin thinning. They are safe for your face and your eyelids, so you might have been prescribed these types of medications for these very sensitive areas, but they still do not address the root causes. We still have this problem of applying and then it improves, you stop, and then it flares again. And there are some unfortunate side effects, that we want to be afraid, a little more cautious of is the FDA black box cancer warning. Now, this cancer warning is in animal studies. This is not confirmed in humans, but it's something we want to pay attention to. And then sometimes people report burning and stinging on applications. So, we need a better way. And the question is, are there topicals that can actually address some of the root causes of eczema? And that is really the question we want to answer today. And yes, my answer to that question is yes, there are. So, stay tuned. Let's talk about this. Let's dive into the topicals that we can use to actually give us relief and also address the root causes of eczema. Okay. So, when we're thinking about the root causes of eczema and when we're actually thinking about how can we address those root causes topically? We want to think about three things. So, microbial dysbiosis. What does this mean? Well, we have good bacteria, bad bacteria, we have microbes like yeast, and some of these are supposed to be on our skin and in our gut. And some of these are actually, when they overgrow, they can actually be dysfunctional and they can cause flares. We can have immune reactions to these bugs. And so that's what microbial dysbiosis is. Barrier dysfunction. So when we have a weakened barrier, you do not hold on to moisture on your skin, and you can actually leak a lot of toxins and environmental exposures into your skin, which can cause the last one, which is immune dysregulation, which is an overactive immune response. And this is where we get chronic inflammation, AKA eczema. Okay. So, my approach when I'm using alternative topicals, I'll call them, is to actually compound these topicals with a compounding pharmacy and really target the driver. So if I find that somebody has microbial dysbiosis, they have maybe an overgrowth of yeast or bacteria, and we'll talk about those in a minute, then I might choose specific ingredients to put in those compounded topicals. If I think it's barrier dysfunction, if this is a baby or a child or an infant, and this started right at birth, and we're noticing, okay, we see eczema in the family line. This might be genetic. This person might have low levels of filaggrin, which actually makes our barrier strong. Then, okay, I might use something for barrier dysfunction. Okay, so we want to really customize these formulas, and that's how we get them to work, very well, and potentially even better than your steroid medications at lowering your symptoms and also treating the root cause. Okay, so now when we talk about microbial dysbiosis, we want to break down two really important, microbes that are growing on your skin. And for eczema, there are two that really come up. And the first one is a fungus called Malassezia. It's a fungus or a yeast. And, the problem with this is actually we don't talk about it. We mostly talk about it if somebody has seborrheic dermatitis, which is a type of eczema. But in people with just eczema, atopic dermatitis, not necessarily categorized as seborrheic dermatitis, 65% of adults have a Malassezia overgrowth. 27% of children have a Malassezia overgrowth. And what's the problem with this yeast? Okay, so it can be growing on our system, but there are certain species that tend to activate your immune system, causing an allergy to this yeast. Okay, so this is something we can actually test for. When you have a Malassezia overgrowth, this actually, can overgrow more in a barrier that's really, really weak. And that could be weak because of your genetics. It could be weak for other reasons. And then you can actually have more of this problem as you are scratching and opening that barrier even more. And then it just creates this self-perpetuating cycle, right? And so then you get more and more inflammation, then you get more and more Malassezia growing, and then it just keeps going and going and going. And a lot of our conventional treatments don't necessarily treat Malassezia and help, Malassezia to come down. Our next microbe that is very, very important, and I'm sure a lot of you have heard of this one, it's called Staphylococcus aureus. And this is a bacterial microbiome driver. And you might have heard of this if you had a staph infection. That's how people usually hear about this. But often, Staph aureus is actually one of the main drivers of eczema on the skin, even if you're not having an active infection. It's found on the skin of 70 to 90% of eczema patients. So Staph aureus is found on the skin of 70 to 90% of eczema patients. And when they actually test the eczema lesions, 70 to 90% of those lesions will have Staph aureus overgrowing. And on healthy skin, we're seeing, less than 5%. 90%. So we know that this is a driver of eczema. And Staph aureus does produce what are called super antigens, and this drives the immune response into overdrive. Okay, and that's all eczema is your immune system just going crazy and haywire. Okay, and, this worsens with severity. So the colonization rate rises when you have a higher disease severity. So if you have moderate to severe eczema, we're going to, most definitely find Staph aureus typically if we're doing a microbiome culture. And atopic dermatitis patients or eczema patients are 19.7 times more likely to be colonized with Staph aureus than healthy controls. Okay, so this is a bacteria you need to learn about and you need to know about, and you need to know, what can I do about it? Well, one of the most easy topicals that you can use is called hypochlorous acid, and this really targets Staph aureus on the skin. Now, the great thing is your body actually naturally makes hypochlorous acid, and these neutrophils or these cells in your body actually release it naturally to kill pathogens. And we can just spray this on the skin. So it's really a simple way, inexpensive, something that you all can access. And as I mentioned, 70 to 90% of those eczema lesions have Staph aureus. So if you have eczema, there's a good bet that you might, be able to use hypochlorous acid and see some improvement. So 73% of eczema patients report reduced itching within 72 hours in a 2018 clinical study, and it kills Staph aureus pretty quickly. As soon as you spray that on your skin, within 3 minutes of topical application, you're seeing that Staph aureus, be killed. So, you want to be using it potentially frequently, so potentially up to every 4 hours if you are feeling like it's improving things. And because we need to just stop that cycle that we talked about earlier. Okay. And the great thing is, one of the conventional ways of killing Staph aureus is to use antibiotics. And the great thing with hypochlorous acid is we're not going to get any antibiotic resistance. This destroys bacteria and the biofilms directly, and the pathogens actually cannot develop resistance. So this is a really great tool. At Clean Body, we sell a product called Clean Skin Calm. And if you want the link, DM me Calm, and I'll send you the link and a 10% off for this product. Okay. So this is a great one that you can just kind of, I usually recommend for my eczema patients, get 3 bottles, put it in your gym bag, put it on your, nightstand and in your kitchen, just wherever you can, to be spraying this, because it actually does reduce the itch, and it can be treating the root cause, which doesn't just reduce the itch in the moment, but it can actually reduce the itch long term. Okay, so this is a great one to consider. Now, if we are thinking, if you're working with a naturopathic doctor like myself, then we can do a little bit more, and we can actually compound topicals for you. So one of my favorites to address both Malassezia and Staph aureus is a topical called Zinc Pyrithione. And you might have heard of this in anti-dandruff shampoos. So this is really common, and actually the cause of dandruff is also Malassezia. So that's why it works well for those anti-dandruff shampoos. But we can actually use this topically, and we want to go with a really, really low potency, because sometimes it can irritate the skin. And so this is why it needs to be compounded. Also, this has medicinal action. So you can't just necessarily get a cream with Zinc Pyrithione, off the counter. Typically, this does need to be compounded by a doctor. And what's great about this is it is a broad spectrum bactericidal. So it will affect Staph aureus, but it also affects Malassezia. So it's kind of a 2-for-1. It's really awesome. In a 4-week eczema study, Zinc Pyrithione normalized the microbiome, which means it reduced Staphylococcus better than non-antibacterial moisturizers. And the same ingredient actually addresses also Malassezia. So this is so awesome, right? And again, just like the hypochlorous acid, we don't get the antibiotic resistance risk. So this is a really great, and we're going to look at a case in a moment where we use this on an infant, actually. Okay. So it calms the skin directly. And what we actually see is that in studies, we see that the benefits last beyond the treatment period. So it lasts beyond. If you're just using a steroid or tacrolimus, it actually lasts beyond that. And so we don't have to keep using the zinc parathione. Often we just use it and then after the period where the skin gets better, we stop and we don't see a return of symptoms. And this was in a study. It actually outperformed steroid creams and tacrolimus in post-treatment improvement. So this is a really wonderful tool if you're working with a naturopathic doctor like myself. And not all naturopathic doctors know about this, but this is something that we can compound in a pharmacy, okay? And so this is that study that I was talking about. After stopping all treatments, zinc parathione, the parathione group actually continued to improve. The steroid group got worse, and the tacrolimus group got worse. Okay, so the baseline here is zinc parathione addresses the microbial root cause, not just the symptoms. And so this is what I'm talking about: using topicals that actually address the root cause, not just treating the symptoms of inflammation, where then everything comes back when you stop. Okay. All right. So, how do you know that zinc parathione is good for you? Well, if you get itchy on oily areas like your scalp, your eyebrows, your nose, your chest, if you have a lot of scaling in those areas, then zinc parathione could be a good option. If you have suspected yeast, and that you might need to do some testing to understand that or to work with a practitioner. And if conventional treatments have failed, so often because those steroids or calcineurin inhibitors are only lowering the inflammation and not really addressing the reason the inflammation is happening, then we can see that even when you're using those treatments, your symptoms are still not getting better. And if that's happening, then you might want to search deeper for suspected yeast on the skin. Okay. And then long-term maintenance. So if we use it and the cause is treated, then our skin gets better. So, I think this is a really great option. All right. Now, vitamin D is interesting because we always see that these levels are lower in eczema patients. I see vitamin D levels as low as fives and tens in a lot of my eczema patients when I run these on blood tests. And where we want the vitamin D to be is closer to around 50 to 75. Okay. And so this is really important, especially in children. This is strongly linked to severity of eczema when we have low vitamin D. So, first off, I typically recommend with my patients get your vitamin D tested, get out in the sun, take vitamin D orally. But now we want to think, can we actually use vitamin D topically? Well, we have found that yes, we can. Vitamin D topically can strengthen the skin barrier, it can calm inflammation, and it can support your skin's ability to fight yeast and bacteria. Now, we have seen that high dose vitamin D creams, when used for psoriasis, can sometimes irritate the skin. So that can sometimes be too strong. So we want to really compound vitamin D at the right concentration and combine vitamin D with other ingredients to also with that combination really help the skin to heal faster. Animal studies do show that topical vitamin D reduces eczema inflammation and skin thickening when combined correctly. So I love vitamin D, and I actually love pairing vitamin D with zinc parathione, and we'll see a case where I did that in a moment, okay? All right. So next we're talking about B12. And actually there's actually pretty good research here. Vitamin B12 topically can calm the skin, the inflammation, redness, etc., without suppressing your inflammatory markers, right? So this reduces those inflammatory mediators, but it doesn't suppress like a steroid does or like a tacrolimus does, okay? And so that can calm the itching, and it's very, very safe for long-term use, and I do use this even in infants, okay? So in a placebo-controlled trial, we saw significantly greater improvement. 50% plus rated it good or very good in terms of lowering the eczema severity and eczema symptoms, okay? And so it was B12 versus a moisturizer, and it substantially reduced that eczema severity over several months of use, okay? And multiple studies have actually consistently shown that B12 can reduce overall eczema severity across diverse patient groups, and that's actually important, okay? So I like to use B12 as, if someone has a lot of inflammation, a lot of redness, even in a TSW case, I might use B12 because it can actually vasoconstrict all that redness that's happening in a TSW case or topical steroid withdrawal, okay? And then there are two other B vitamins that I really love. So B6, which is pyridoxine, and B3, which is niacinamide. And B6 is really interesting because what we have found is that there is a key protein called filaggrin that really helps hold our skin barrier together. And what we found is that people with eczema actually have lower amounts of filaggrin, and they do potentially, and not every eczema person, but some eczema people do have a genetic variant which causes them not to create this protein and that causes the barrier to actually be very weak. So we might see if there's an infant or a child with eczema, we might see, okay, maybe it has to do with the barrier. Maybe this baby was born with a less than optimal barrier. So what's cool about B6 or pyridoxine is that it improves protective ceramides, and you might have heard of ceramides to use topically on the skin. This is a little bit different. This is actually helping your body to create those ceramides, and it works along with vitamin D and B12, so I like using them all together. B3 or niacinamide has multi-action. So it's a great one. You'll actually see niacinamide in a lot of cosmetic products out there. It calms inflammation, reduces itching, strengthens barrier, and retains moisture. So a great one to just add in, and you will see that one in cosmetic products out there, okay? Now, how do we pick and choose these topicals? And how do we optimize? And we have to really understand what the root causes are. So testing is important. We can do testing for your skin microbiome, your gut microbiome. We can do vitamin D testing. We can test for allergy to that yeast, Malassezia. And all of that can help me to build a combination of ingredients that will help to target whatever you're dealing with, okay? So if you have a lot of inflammation and itchiness, we might use B12 plus niacinamide. If you have that oily flare, that oily area flare where you get a lot of flakiness. And so we think that Malassezia is there, or we test that Malassezia is present in excess, then we might use zinc pyrithione with vitamin D. And, if there's severe itching, there are more ingredients that we don't have time to go into today, but there's an ingredient called topical naltrexone that we can use for severe itching. So no single ingredient works for everyone. We do personalize it in my practice when I'm working with people. And I am trying to use these to both lower inflammation, to give the patient some immediate support, but also to address those drivers. So, I talk a lot about the drivers that are inside of our body and how do we heal those from the inside out, but we can use topicals to help heal faster. And this can be a really great tool that we use when we're going through this healing process. And so, a lot of people ask me, so Dr. Fong, okay, what products can I get? Can I get these over the counter? And yes, you can actually find topical B12, for example, over the counter. And that can work well. Unfortunately, though, some of these over the counter products have oils that if you have a Malassezia overgrowth, that might actually feed your Malassezia. So there are oils that feed Malassezia. Malassezia loves to feed on oils and sweat. And so when you are using B12, if you're using the over the counter product, you have a Malassezia problem, you might then get a worsened reaction, and you might think that's because of the B12, but it actually might be because of the oils that are in that product. So you can find some of these commercially, but it might still not be the right product for you, and it might not be the right concentration. It might not be the right combination. The base might be full of fragrances, preservatives, emulsifiers that irritate your skin. And we need to personalize this to you. You can think about trying some products, over the counter, but you may not be getting the same results as if we compound those for you, and personalize them. Okay. All right. So let's talk about some cases. Let's go into a 9-month old, and this is a real patient story. And if you want to actually see the testimonial that this woman did for us, it's on my YouTube, which is at Clean Body Health. Or if you're on Instagram, just DM me and DM me Topicals, and I'll send you the link to this story of this 9-month old. So this 9-month old had severe eczema on her inner arms, ankles, and multiple body areas. It was bright red, itchy, and wounded, and it was constantly itchy. And the whole family had sleepless nights. Everybody knows this. If you have a kid with eczema, you know that nobody is sleeping. Multiple treatments had already failed, and this baby was also born via C-section, which means that she did not get the good microbes from mom's vaginal flora because she was not born vaginally. So she did have a poor microbiome that we uncovered. And this is actually something that, we wanted to go internal and work on the microbiome internally, but we also wanted to give her some relief because this family was having such a hard time, not sleeping, so itchy. And when your baby is going through this is a difficult process, right? So 14 days, and we saw that with the use of topical B12, topical B6, and vitamin D, we see that day 1 there was severe redness and scaling. Day 7 and day 7 and day 4 and day 7 we see improvement already, and day 14 we actually see near complete resolution. Now, that doesn't mean that was the end of our road working together, but at least this topical had provided some relief for this family. And then we continue to do work internally to work on that gut microbiome. And as we can see, if you guys are watching this, we worked together from November 2020 to February 2022. And this mama says, my girl is free from eczema, 2 years of perseverance, dietary shifts, topical vitamin D, and gut support. And if you're watching this, you can see the shift between, redness and scaliness on the back and on the ankles, and it's completely gone, okay? And we didn't use steroids. Again, we used that topical, but we also did some internal things. We adjusted the diet. We worked on the microbiome, and that was a big one because this child was born via C-section, okay? So if you want to watch this mother's story, go to my YouTube at Clean Body Health and go to testimonials, and you'll see it there, or just DM me Topicals if you are on IG. And this next story is a 5-month-old. So this 5-month-old had cradle cap, thrush, eczema on the forehead, neck, back, and arms. We saw a lot of scaliness. So cradle cap, everyone, is actually really similar to when you have dandruff or seborrheic dermatitis in adults. And so this is actually caused by that yeast called Malassezia, okay? And what we also see is, you'll see in a minute, mapping on the skin. And so if anyone has eczema and you kind of see like continents on the skin, I like to call that mapping on the skin. Constantly unbearable itching, sleepless nights as well for this family. And this child was also born via C-section, so also had a poor microbiome. And that poor microbiome leads to yeast just overgrowing. So, if you're an adult and you ever have taken antibiotics and you end up with a yeast infection as a woman, this is really, really similar. So, at the top, we see the before, where this 5-month old basically had little continents all over her body, on her neck and on her arms. And with a topical support as well as internal support, and we did use topical zinc pyrithione and hypochlorous acid, we see improvement and, complete resolution here. And then that cradle cap that we see on the forehead and the scalp, and we see it's completely clear. And then on the back again, we see all this mapping and completely clear. Okay, so what did we do? We did not use steroids. Topical vitamin D, topical zinc pyrithione. That zinc pyrithione is safe for that little one. We're using it at such a low concentration, and we adjusted the diet of the breastfeeding mother, and we did the microbiome support for mom and baby. Okay, so this is just a little peek as to how do we actually address the drivers of eczema. And I know we always talk about those internal drivers, and addressing the external drivers as well can be super helpful. So how do you know if topical compounded medications are right for you? Well, if you want to reduce or avoid long-term steroids, if you want to treat your face, eyelids, or sensitive areas, and you really want to get to the root cause, because a lot of those areas can be due to that yeast overgrowing. If you're stuck in this cycle of apply, improve, flare, apply, improve, flare, and if you don't want to use steroids or even calcineurin inhibitors anymore, then this might be something to consider. And if you have eczema in really oily areas like your scalp or your nose, that could mean that there is a Malassezia overgrowth, and this could be, a good option. Now, one thing that we are developing at Clean Body that I'm so, so excited about is actually a clean skin microbiome test. And this is coming next month. So definitely, if you're on Instagram, follow me for updates. Follow me on YouTube as well, so that you can know when this comes out, because if you have eczema, this might be a really helpful tool to help you to understand, is Staph aureus really growing? Is Malassezia really growing? Should I be avoiding these oils like shea butter and jojoba oil and olive oil, and pretty much all of the oils which feed Malassezia? The list of oils that you can use if you have Malassezia is very, very short. So, if you're using these oils on your skin and you notice more flares, Malassezia might be overgrowing. Okay. If you're interested in using hypochlorous acid, just DM me calm, the word calm, and then I'll send you the link as well as a 10% off for buying that product. Okay. And how do you really understand what the drivers are for you? Well, like to start when I'm working with people in my practice with something called an eczema clarity visit, because I think the first thing we want to get is clarity, right? We want to understand, why do we actually have these symptoms, and what are we going to do that's not steroids, that's not calcineurin inhibitors. So what we would do together in an eczema clarity visit is review your symptom patterns and triggers, identify your root cause drivers. Think about what testing might be great for you: organ health testing, skin microbiome, gut microbiome, hormones, toxic load. And then think about, are compounded topicals the right option for you topically as we're working on the internal system. Okay. So if you want help figuring out what's driving your eczema, just DM me. If you're on Instagram, DM me the word clarity, and I will ask you a few questions and help you point you in the right direction. If you are not on Instagram, you can shoot us a message at info@cleanbody.health, or just check out our website at cleanbody.health. Okay. So now I want to open it up to questions. Thank you to those who have joined me today. And let's see if any questions have come up so far. I like honey, but I don't know if it addresses the root causes. Okay. So this person is actually talking about using honey topically, and that is an option. There is an antimicrobial aspect to using honey that actually helps on the skin. So some people actually do notice some improvement, but this also can be something, if you have yeast growing on your skin, that actually does feed that yeast as well. Okay. Now, you guys, I see that you're commenting clarity and calm on this comment on this live. Can you actually just DM me directly, like send me a message, clarity and calm, if you guys can just do that, because if you comment here, unfortunately, I won't see it. It goes away after this live, so I won't be able to respond back to you, okay? Where can we get a list of the oils that we can use? That is a great question. If you DM me the word is it fungal or fungus? I think it's the word fungal. Then you will actually get my Dr. Fong's guide to fungal eczema. And in that guide, you'll see the list of oils. You can also go to my website at cleanbody.health/eczema tools, and you'll see that eczema guide, that fungal guide there as well too. Okay. So I want to answer questions now, everyone. And I'm actually going to go into my Instagram and pull up, because I did post on my story and I asked a bunch of, you guys to give me questions, and some people did give me some questions. So I'm going to pull those up while we're waiting here, but we are going to we are going to answer these questions. Okay. Any negatives to using hypochlorous acid every day, multiple times a day? No, there are really not any negatives necessarily, and of course, I want everyone to know that you do want to consult with your doctor before using any products that I've mentioned here, and also this is for educational purposes only. I'm not diagnosing you or telling you what you guys should use, and everybody's different. So you really should be working with a practitioner. But in general, hypochlorous acid is okay to use multiple times a day, especially if you have eczema, because we know if you have eczema, you likely have Staph aureus that is overgrowing a bit. Okay. And so it is okay. And often, even up to every 4 hours, although with our product, I recommend just twice a day. And so, twice a day, morning and night. And if you exercise or work out and you sweat and you end up getting more eczema, or you just get really irritated by that sweat, well, Malassezia, that yeast I was talking about, everyone, feeds on that sweat and those oils. And so you might want to put Clean Skin Calm in your gym bag and just spray all over as soon as you stop working out, and then come home, take a shower, and make sure you clean all of that up, because Malassezia loves to feed on that yeast. Okay. We all cook our meals with olive oil. Is that also a driver when ingested? Really good question. Not necessarily, although a diet high in fat, too high in fat, is potentially not going to be good for someone with eczema, but olive oil is a great option. I will say olive oil is not always the best to cook with, though. So you can use olive oil, and olive oil is can be something that some of my eczema patients can be allergic or sensitive to. So these are all questions that I kind of look at and answer. But when you ingest it, it's not going to feed your Malassezia on your skin like it is if you put the olive oil on your skin. Okay. The olive oil question, is not going to feed that Malassezia, but we want to think about olive oil in other ways. Is that good to have in the diet? Are you sensitive, allergic to it, etc.? So those are the questions we would ask about that. Okay. Is your care covered by insurance? So, as a naturopathic doctor, our care tends to be a lot more comprehensive than your conventional doctor. And because of that, the insurance companies pay for typically, short 15-minute visits, as you probably all have recognized. You go to your dermatologist, you spend like 10 to 15 minutes with the dermatologist gives you a medication and you're out. Boom. And that's different for a naturopathic doctor. So a lot of us tend to not take insurance because it actually doesn't cover our care. Our first visits tend to be anywhere from an hour to an hour and a half, and our follow-ups are anywhere from 45 minutes to an hour. And so typically what we do is we actually provide super bills to our patients where you can get your the visits reimbursed if you live in certain states. Okay, so not in every state, but if you live in certain states where we have licensure or whatnot. And for me, that would be California. And I also have a nutritionist on my team. And for her, she can actually, in multiple states, there are places that she can She can accept insurance. I'm sorry, create super bills. And I can also do that for people in Maine as well too. Okay. In other places, most of it is out of pocket, but we do also accept FSA or HSA. Okay. Any shampoo recommendations for yeast? Actually, I do have some shampoo recommendations. So, if you have dandruff, you are looking at potentially a Malassezia overgrowth. So, actual shampoos that have zinc pyrithione are an option for you. And I know there's one called Nappy Cappy, just off the top of my head, that has zinc pyrithione. So you can think of something like that. And then there are many shampoos out there, but you want to make sure that there aren't any nasty things in there like fragrance and other things that don't need to be in there. Okay. All right. How much are your services? Great question. So, the clarity visit, which is how things begin with us, is a 25-minute virtual consultation with myself. So you'll talk directly to me, and that is $97. So that's how the care starts. And then we have multiple options after that that range anywhere from like, $200, a month for care, and up to $1,000 per month for care. So it just kind of depends what you're looking for. And we also have an educational program that's $57 per month. You can cancel anytime and you can get all the information, and then, you can cancel at any time. Okay. So it just kind of depends. And the clarity visit helps both of us gain clarity as to what are we trying to do here, what is best for you, what are your potential drivers, do you need to focus on diet, should we focus on topical, should we do all of the above, do you have a yeast overgrowth, a bacterial overgrowth, do you have heavy metal toxicity, so we can talk about that, and your story will typically tell me where we need to go. If you are on Instagram and you DM me the word clarity, I will then respond back to you and we'll have a little bit of a conversation so that we can talk a little bit further and understand what's the best route for you. Okay, so I'll ask you a bunch of questions. All right, is a oil of oregano good for the yeast overgrowth in the gut? Great question. So oil of oregano is an antimicrobial, and it is something that we can use to address microbe overgrowth in the gut. But I will say it is not safe to do this on your own. And what has happened is, I often will see patients who have been taking, they're like, oh, this, and even someone like myself, okay, said that yeast might be a problem for eczema and recommended all these supplements. And I've been taking them for like 9 months, and now my eczema is worse. And the problem is, first off, if you don't do any testing, you don't know exactly what you're targeting. And then the timeline, you should not be using these antimicrobial herbs for more than 6 to 12 weeks, because you can actually destroy your microbiome that way. Even though it's a natural product, these are still antibiotic, anti-parasitic, etc., whatever you're using, right? So they still have these actions that you don't want to use them just freely. And you also want to make sure, because not everybody's skin has the same drivers. And so you want to make sure, okay, yes, yeast is my problem. And how to use it, what dose, all of this, is really important. So I caution you to not just be, using oil of oregano, and then you might notice, oh my gosh, my skin is worse. Now, what is that? Is that a die-off reaction? Is it a detox reaction? Or are you allergic to the supplement? And so, it's helpful to work with someone. During a clarity visit, can you look at the skin? Absolutely. So during a clarity visit, here is what we do. So we give you access to our journaling system. We ask that you actually journal leading up to your clarity visit. We want to see pictures of your skin. I want to see pictures of your poop. I know that's a little crazy, but your gut is so important when it comes to skin health. So I want to see pictures of your poop. I want to see pictures of the food that you're eating. I want to see the products that you're using. So you take pictures of all your products and anything else you want to share, because we're trying to gain clarity about your eczema at this visit. And so we want to understand, every aspect of your life. every facet of your life. Because often we're looking at eczema in conventional medicine and we're just saying, oh, that's what's going on with your skin. Here's the medication. And what I want to do is I want to go deeper. I want to say, okay, eczema is typically caused by inflammation. Why are you inflamed? And are there factors in your life that are causing that inflammation? It's very well possible. So maybe it's your laundry detergent. Maybe it's the food you're eating. Maybe you're eating a bunch of sugar. All of these can be root causes. Okay. These are great questions, everyone. Keep them coming. I'm going to go back to the story, my story questions where I asked people to put questions in and I will answer these. So, next question is, what topical brands do you recommend with all the ingredients? So, again, there isn't really a commercial product that has all of these. And I do caution you necessarily just using products and just trying them. Sometimes they work, sometimes they don't. And as I said, I know there's a topical B12 that I have sometimes used that you can buy over the counter. But if you have a Malassezia problem, there are probably oils in there that might not be good for you. So, you just have to kind of weigh those and maybe you just try it, see how it goes and see if it helps. Okay. Have you worked with children who were using the Dr. Aaron's method with topical steroids? Absolutely. So, Dr. Aaron's method, everybody, for those of you who don't know, Dr. Aaron's method does use a very low dose topical steroid. And even with that, after stopping that, you can get rebound or topical steroid withdrawal. And yes, absolutely, I've worked with many, many clients who were on the Dr. Aaron's method and ended up with some topical steroid withdrawal, or just ended up not having the results that they wanted at the end. Okay. Um, okay, so someone on my story said, it's mostly inflamed after a shower. I try to make sure the water is more warm than hot. Please help. Okay. So if you flare after a shower, a number of factors could be at play here. So, number one, I want you to look at your water. Make sure that your water is filtered. Make sure that you are getting good filtration of that water to take out all of the heavy metals and other junk that's in your tap water. If you go to EWG, there's a wonderful resource where you can actually look up your tap water and see how many toxins are in your tap water, and then also the recommended filters. Okay. We also have that product information. If you go to cleanbody.health/filters, you can see the filters that I recommend. That might be the first thing I might say is your water may actually be causing some reactions if your water is toxic. Next, I might say that, okay, if it's warm water, you might want to try more cool water because hot actually increases our inflammation overall. And so we do love cold therapy with any kind of eczema treatment. Cold just kind of closes everything up and makes all that inflammation come down. So it might also just be the warmth of your shower as well. Okay. Same person says, my shoulder blade now, it's basically the size of my hand wrapped around the front of and it doesn't I can't see the rest of it, but it looks like this person is saying that she had a small eruption that's kind of now turned really big on her shoulder blade. So really interesting. Okay, so on your shoulder blade, so that's an interesting area, and I will say that those areas, like kind of around your armpits, if you guys have a lot of eczema eruptions on the armpit area, around the armpit, on the shoulder blade, and the back in that area, I do like to look at microbiome there because we sweat a lot there. And I will say that Malassezia can be really prominent there. Okay. So stay tuned, everyone. I am releasing a skin microbiome test kit. So if you are interested in learning, what microbes are growing on my skin, stay tuned. Follow me. Make sure to follow me, and I'll be announcing that soon. Okay. My eczema keeps spreading. How can I stop it? It started out 10 years ago, the size of a quarter. Okay, if it keeps spreading, then more than likely, whatever is triggering that eczema, you are still exposed to, whether that be food, environment, emotional, etc. All of these are possibilities, okay? So we have to address and understand what is the root for you. And then that is probably still going on, okay? So we need to make sure to address that. Are water softeners good for eczema prone skin? Okay, so water softeners, For water softeners, they aren't necessarily cleaning the water. So if you use a water softener, see if your water softener system also has a filtration system. I would say water softeners are themselves are not going to be necessarily harmful to the eczema prone skin, but know that you might not be cleaning your water with a water softener. Okay, so that you want to do both. Does Dupixent really help? Okay, so Dupixent, what is Dupixent, everyone? Dupixent is a biologic. It lowers the immune response, okay? And for people with very severe conditions, sometimes Dupixent can be a lifesaver, right? Um, there are some side effects that people report, like eye symptoms, and I've even spoken to one person who unfortunately ended up 95% blind after using Dupixent. Now, that doesn't occur for everybody, but people do sometimes walk away with eye symptoms that never go away. So that's something to think about. I have also noticed that when people use it and it's improves their condition, it often doesn't last. And usually about 3 years in, it tends to stop working. And then now the eczema comes back with a vengeance. Okay. And also in my practice for severe conditions, sometimes I will use Dupixent for maybe a month or 2 or 3 while we're getting to the root cause. And then once everything starts to get better, we stop those injections. Okay. So I think if you just use Dupixent and you have no other plan beyond that, eventually it's probably potentially going to stop working for you. And you're going to have to find an answer at that point. Um the other thing is I haven't noticed Dupixent actually clear all of the eczema. Often it just makes it the condition just way better and you can now live life, but you still have eczema. Okay? So I would say it's not a long-term answer, but it is potentially an answer for some people who are very severe. Okay, more questions, please. I'd love to answer them. And the last one from my story is how do I get rid of the dark spots and discoloration that eczema leaves? Okay, so depending on what the pigmentation of your skin is, eczema can actually cause, if you're darker in pigmentation, it can cause light spots. And if you're lighter in pigmentation, sometimes it can cause dark spots and discoloration. And that is often from the inflammation that's just caused by the eczema and caused by the scratching. And as the skin is healing, you might notice a hypo or hyperpigmentation, so a change in the color of the skin. And if you stop abusing that area with scratching, then you will notice that over time this will improve. Okay. There are some natural products that you can use that are out there just to kind of feed the skin that have like vitamin E and some nourishing nutrients to just help the skin to heal faster. Even natural products that are for scars and things like that may actually help the skin to kind of rebuild rebuild a lot faster. But over time, that will also get better as long as you are not damaging that skin over and over again. Okay. So if you keep having eczema and you keep having this cycle, it's not going to get better. So what you want to really focus on is okay, get rid of the eczema, make sure you're not scratching anymore. Okay. All right, everyone, this has been so great. So, what I wanted to say is if you missed this live, this does become a podcast episode. It's going to be episode number 22 on my podcast called Live with the Eczema Doc. So, if you are not following my podcast yet, definitely follow my podcast, Live with the Eczema Doc. And it will be posted later this week. So definitely tune into that. If anyone has any other questions, you can DM me. So if you're on Instagram, just send me a message and I'm happy to answer any messages personally. And if you message me clarity, then I will ask you more questions so that I can give you a little bit of clarity about your eczema and whether an eczema clarity visit would be a next good step. Okay. All right. If no one has any other questions, I don't see any other questions coming in. Thank you so much for joining me today. And we're going to do this once a month, about the second Sunday of the month. So stay tuned. And if you have any topics you want me to cover, please go ahead and DM me and let me know what those are. I'm happy to cover those on these lives and make sure that you are getting all the information you need to heal your skin from the inside out. Okay, everyone, thank you and have a great